our content for the audience. If you want to share with us, first off, which country are you representing this morning? So where, or evening, or whatever part of your day. If you want to share what country you are from, but also if you would like to share with us what is your background and experience of education and advocacy, and what category of practitioner you are. Again, thinking about the different ways that we might be experiencing navigating how to become involved with advocacy and policy. And then, which level do you consider yourself with educational advocacy and policy? And again, that can be a product of both our training in this area or our experiences that we have had and held to get to this moment in time. This session would not be possible without the work of our incredible collaborators. And it is important as we go through that we have individuals who are championing, helping to raise and helping to highlight different voices of experts that have had experience in this area. And so it is with great pleasure that I will introduce Barry Blight, who has been a part of this series. And Barry has assisted alongside with input from Nadia as well to generate the speakers, to generate the expertise that you will hear today in today's events. As you progress throughout today's event, if you would like to have any sort of follow-up related to the series, if there are any questions or any points or resources, Barry and Nadia and myself will serve as point or contact individuals to help get those questions answered for you. As we go through our session, for participants, we will be monitoring the chat for any questions that you have come up. We will try our best to answer some of those in the chat if able. And then when we get to the very end, we will have a time where we will summarize for the speakers what the questions are that they can add to the process. Okay, and I am going to also introduce the format. We will be beginning with our overall speaker introductions. We will introduce the rationale for each component as we go through, and we have started to do that. We will have a question and answer series for the panel where a specific question will be directed at the speaker. And then at the end, we will have our wrap up and our summary. So I'm going to turn it over to Barry, who is going to guide us through a little bit of how you can be involved again in that discussion. And he will introduce our prestigious speakers today. Barry, you are still on mute.
I sure am, and I was just rambling on. But anyway, welcome everybody. It looks like you've got people from all around the world, and I'm very excited to see that. We've got a very exciting program planned for you today, and our format will be that we'll have a series of questions to be asked of our external panelists, to whom you will be introduced as we go through, and this will all be moderated by Professor Dixon Thomas from the Gulf Medical University. And so what I wanted to talk about is that how to get you involved. What I want to do is to let you know that if you put questions in the chat, Janine and I will look at that. We will do things. We will answer questions in the chat. We will put it in to do that. So that's one of the ways you can become involved in this webinar. And the second way is at the end, we will show you how through FIP you can become more involved in some of these activities that we're doing. Janine, I'm going to ask you if you would go ahead. I don't have the detailed bio of Dr. Thomas that I can't seem to locate it on my computer right now. So if you want to introduce our distinguished moderator, I would greatly appreciate that.
Excellent. So Dixon Thomas is a professor and an associate dean at Gulf Medical University. He also is a prolific writer and advocate for clinical pharmacy education, Arab Emirates, and the region. One of the things that has been most notable about Dixon as he has progressed throughout his career is his involvement in immunizations and infectious diseases. These are two causes that are great examples of how Dixon has championed advocacy and policy efforts at different components of time and throughout the COVID-19 pandemic. And he is, again, continuing to be involved with different stages of research and clinical practice, including helping to expose individuals from around the world to practice specifics and practice expertise from his particular region and country. With that, I will turn it back to Barry to continue.
Thank you very much. I'm just going to say, by the way, Dr. Dixon, we do have one of your students already on here. So I know that. So I'm excited to see that. So as we begin, Janine, are we doing all the speakers right now, or are we going to do them as they come up?
Yes. So you can do all of the speakers, and then again, we will proceed to the discussion as we go through.
Okay. That I can take care of. I'm getting up. We have a series of speakers for you today. The first one is going to be Dr. Youssef Asiri, who's from King Saud University, University of the University of Pacific, and he's a professor of clinical pharmacy in Saudi Arabia, who will be one of our panelists. And also another very distinguished individual, Dr. Suhaib Mufli, who is who's an associate professor and an associate dean of student affairs at Jordan University of Science and Technology in Jordan. And we're very excited to have him. We also have with us Dr. Nesreen Murad, who's the chairperson of pharmaceutical sciences in the Department and School of Pharmacy at Lebanese International University in Lebanon. And we also have another very distinguished individual, Mansour Al-Mugbil, who's the dean at the College of Pharmacy at oh boy, I'll get this one. I can barely see with my glasses on. Al Marifa University, and he's an associate professor of pharmacoepidemiology and drug safety. Both Dr. Mansour and Dr. Suhaib have very distinguished educations that I will let them go into, but I had the pleasure of them being in my graduate program. So very proud to see their accomplishments going on. So at the end of this panel, we will hopefully be able to identify some of the challenges that are faced, by stakeholders. And today we're concentrating on the Eastern Mediterranean region of FIP, which is also the Eastern Mediterranean region of WHO. They try to be in congruence together. And we want to describe some of the importance of aligning the pharmacy educational advocacies to policy change. Okay, so how do we use policy change, or how do we use advocacy to make policy changes? How do policy changes influence advocacy and practice especially? We do have one of our speakers, Dr. Nesreen, will be talking about best practices. And then to summarize the best practices, I said, from our different stakeholders that could help us shape our educational policies. We want to, by the end of the thing, we want to identify collaborative methods that we can use to assist in the advocacy efforts that we have with the FIP academic section, that is. If you notice that we'll all have fairly similar backgrounds, and that's the annual meeting, which we'll talk about towards the end, that's coming up in September, late August, early September in Cape Town, South Africa. And we're hoping some of you will be excited enough to want to attend that with us. So Janine, I think we're ready to move to the next thing.
Okay, again, we've introduced the format of today's discussion, but now we will turn it over to Dixon, who will moderate us through. He will introduce himself, and then he will also introduce and ask the questions of each speaker.
Yeah, many thanks, Janine, for this wonderful opportunity for all of us here, including the participants. And as you said, we have wonderful panel of experts here trying to speak about a very important topic, which is advocacy and policy. How does that affect our education and practice, which is going hand in hand? So the first question is to very able, our Dr. Mansoor, to speak about what challenges did you face related to advocacy and policy change in your region and country. Over to Dr. Mansoor.
Thank you, Dr. Thomas, for introducing, and thank you, Dr. Barry, at the beginning to introducing me, and thank you, Dr. Thomas, for directing this question for me. Before I start, I would like to thank the FIP for this fabulous event, and that is very important for our region to shape the education and the pharmacy profession in our region. Back to the question regarding what challenge if you go back to the question, please. What challenge did you face related to advocacy and policy in our region? The first thing that came up to in my mind is when we implement the national examination for our pharmacy graduate in our country. Before 2019, whoever graduated from the school is directly registered as being a pharmacist, and he or she can practice directly. And that was fine because at that time we have only one school of university. And after 2006, almost the second pharmacy school opened. Then, when we reached to about 2017, we end up having 30 college of pharmacy and about 3,000 graduate every year of pharmacists in our country. Having this number from different university, different college, different background, showing us that the School of Pharmacy must be not the School of Pharmacy. I mean the Saudi Commission for Health Science must have an exam that check if the pharmacist have the minimal level that he or she will be or he has to be ready for a practice of pharmacy. So when they implemented in 2019, some of the school of pharmacy that are not ready because of the curriculum. At that time, we adopted the 5G that come from United States, the same competency. So we adopted here. So when we ask, when the student or the graduate have the exam, it was not easy for them. They are not easy for to pass the exam, and which fire back to the school, fire back to the curriculum, and there are a lot of changes, a lot of effort from the university and the school, the College of Pharmacy to change and update their curriculum to match the or to match the competency of the national examination, which allowed us to shape the education. And right now, thanks for God, now the exam is very smooth. All the graduates are well prepared. They are ready for the exam. And we are assuring now that whoever passes from that exam is able to practice the pharmacy profession and it will be safe for the patient, safe for the field all. This was the first challenge that came up to in my mind regarding to the pharmacy education. If you allow me, I can go more about the practice what we have challenged when you adopt a new policy in for practice of pharmacy profession,
Yeah,
if you want me to add.
that will be good. That will be good, Dr. Mansoor. So if we point out few challenges, few extra challenges,
Okay.
that will be very insightful. Yeah.
Okay. One of the challenge also that we faced is maybe I'm not sure what's the date, but it was around 2010 or 11. We used to have all the medication can be dispensed without prescription, even especially from retail pharmacy or community pharmacy. However, a new policy or a new rule that's saying that all antibiotic, all chronic disease must have prescription in the community pharmacy to be filled and dispensed. Uh, we have some challenging difficulty in the community pharmacy regarding how to adapt that, how to monitor that. And the only reason why we do that is the Saudi government, when they, Saudi Ministry of Health, when they adopt this one, is to make sure that the antibiotic will be dispensed appropriately. We are afraid of having antibiotic resistance. This was the reason behind it for the chronic medication use or the chronic disease. The medication for chronic disease, also the same thing. We make sure that the patient has a history of the medication. They will dispense or get the medication without any duplication. And thanks for God, now it's all smooth. However, during that time, we faced many challenging adopting this policy.
Yeah, definitely. Many thanks, Dr. Mansoor. We can move to Nasreen for speaking about some challenges. If she wants to add to this in 1 or 2 minutes, any other challenges, over to Dr. Nasreen.
Yes. Hello. So good morning, good afternoon, and good evening. Before I start, I want to thank the International Pharmaceutical Federation, Dr. Pete, Dr. Abraz, and Dr. Mazruri for their valuable invitation. And thank you for your introduction. It is an absolute honor and pleasure to be here today among you all and among my esteemed colleagues. So actually in Lebanon, we have faced and continue to face several challenges, starting with the resource limitation, which have been a significant burden for us, especially in the context of the ongoing economic crisis in Lebanon since 2019. And as you know, funding constraints often restrict our ability to implement comprehensive educational reforms and limited access to educational technology and resources. Another challenge would be navigating regulatory barriers. In fact, implementing policy changes can be slow due to the complex regulation and sometimes resistant change. Also, we have culture and societal barriers, and this poses challenges because you want to shift societal attitudes from traditional educational practices to modern approaches. And of utmost significance is political instability, with the ongoing war in the south of Lebanon, which affect the consistency and sustainability of educational policies, while disrupting the educational system and obstructing its progress. So they're a bit different from Dr. Mansoor.
Yeah, rightly said. Many issues, some common, some different. Yeah, this gives a good room for the next question to move on to understand. If you can move the slide to next question, that is about what are the best practices. Of course, when there are problems or challenges, there are solutions to. So what best practices you are considering related to advocacy and policy in pharmacy education? Over to Dr. Nasreen.
Thank you so much. So in Lebanon, several initiatives have been proven to be successful. So we are trying to overcome all of the obstacles and challenges that I mentioned. So first, I would go for collaborative efforts, partnering among universities to develop and continuously update pharmacy curricula has played a significant role. In addition to working with the Ministry of Education and Higher Education and Ministry of Public Health, because what you want to do is align educational policies with national goals. As such, we have seen the prominent integration of experiential education into our curriculum, shifting the focus toward a more patient-oriented approach, emphasizing on interprofessional collaboration in order to enhance healthcare outcome. And of important notice here that the Lebanese American University School of Pharmacy, headed by its dean, Professor Nasser al-Sharif, organized this February the first annual Lebanese Schools of Pharmacy Symposium in collaboration with all other 4 pharmacy schools in Lebanon, the aim of which was to explore new strategies to advance pharmacy education and practice, as well as improve relationship and collaboration among the different stakeholders of the pharmacy profession. And in this symposium, they addressed 6 themes: pharmacy education, practice, innovation, novel settings, scholarly activity, and research and advocacy. So hopefully next fall, my organization, the Lebanese International University School of Pharmacy, led by esteemed Professor Mohammed Rahal, will host a continuation for this initiative. Second would be the adoption of international standards. In fact, several professional organizations develop competency-based for defining the competency and behaviors needed by pharmacists in their professional practice. For example, the FIP Global Competency Framework, which was revised in 2020, was used to accomplish global harmonization of the required competency and support the education development of pharmacy practitioners worldwide. Whereas in the US, we have the American Association of Colleges of Pharmacy, the AACP, Center for Advancement of Pharmacy Education, CAPE, has pioneered the development of educational outcome to guide curriculum planning, delivery, and assessment. So by implementing globally recognized guidelines, we ensure that our program met high quality standards and maintain excellence. And that's what we did in my organization. After exploring multiple competency framework and tailoring them to meet local needs while having international standards, we came with our own framework. Additionally, we have profession associations, and this is instrumental. In our region, the IVPN network has been playing a fundamental role in advocating for the profession and influencing policy development by organizing webinars, workshops, and continuous professional development program, among many, many other, creating a culture of knowledge transfer and providing a platform for networking, mentorship, competency building, and career advancement. And finally, I cannot stress enough on the importance of research and evidence-based policy, which enabled us to make informed decisions and help shape effective educational policy. And here I would like to highlight Inspect LB in Lebanon, which is a nonprofit autonomous research group of motivated multi-university and multidisciplinary researchers and academics, which was established in order to fill the need of a national research center on health, professional practice, and education in Lebanon. Actually, it was ranked first for 2 consecutive years in research among the Lebanese academic and health institution by Schemago Institutional Ranking. So that's it for me. Thank you.
Yeah, definitely. All this very well said. Nasreen and Mansoor both were speaking about how to make more competent pharmacists or clinical pharmacists. So definitely, it's all about advocacy for patient care. Like the pharmacist needs to make their advocacy to medical doctors or nurses and speak on behalf of patients, and that becomes the whole policy itself. So looking at it from a pharmacy education viewpoint, that PharmD education, which is becoming more popular in Saudi Arabia now, Dr. Mansoor, do you want to add some points about how that pharmacy education transformation in terms of more clinical programs like PharmD, residency, all these are changing
Yes.
how people practice and how patients are getting benefited in Saudi now?
Yes, sure. Well, regarding when we start to implement PharmD curricula, we started back in 2006. We started changing the curriculum from B Pharm or Bachelor of Pharmacy to PharmD. At that time, whoever graduated with the PharmD is considered having the highest level of education in pharmacies. So at that time, they are working as a clinical pharmacist. Whoever having PharmD degree is practice as a clinical pharmacist. And then starting to getting more degrees or more programs of PharmD. So now the entry level is a PharmD. So whoever graduated the PharmD, they needed to have either master of clinical pharmacy, which is up to 2 years, and in order to practice a clinical pharmacist, or having a residency. Each year we have about almost 300 seats of residency. So the graduates are competing with these residency seats, and the residency there we have it 3 years. It's a BGY 1. We have it for 2 years, and the BGY 2 we have it. The specialty is for 1 year. And whoever يعني getting this residency will be able to practice a clinical pharmacist. If you, I would like to add something to in addition to what Nisreen talked about regarding shaping the education. There are two things, if you allow me. First of all, we are implementing pharmacy simulation in the curricula. So we have community pharmacy simulation, we have hospital pharmacy simulation, we have also industrial and regulatory simulation inside the curricula. This is will help the student to have not only acquire them the knowledge but also acquire them the skills, and will be ready for the market needs. The second thing is having in Saudi Arabia, having two society of the pharmacy. We have General Society of Pharmacy, we call it Saudi Pharmaceutical Society. Nowadays we have a Clinical Pharmacy Society. This society will help to give advocate for the practice and for the education. I believe these help to shape the education very well and make sure that our graduate is ready for the market.
Thank you, Dr. Mansoor. And back to Dr. Nisreen, as you have implemented many international best practices in Lebanon, how was it? Like, what was going on very well? Where do you have to adjust it a little bit more to fit to the region?
Hello. So
Hi.
actually, whenever we want to implement something regarding international standards, we always need to take into consideration, this is very important, which is we need to be culture sensitive, and we need to include inclusivity, and we need to go for regional needs. So that's why whenever we were applying competency-based framework and accreditation and so on and so forth, we were adopting all of the international standards and then tailor them to our needs. So this is the basic.
That's wonderful, wonderful. So, is there any plan for making any local competency framework? Because I know in UAE, they have made a local competency framework for pharmacists. So, is there any effort like that there in Lebanon?
I hope so. I hope so. Fact that many of the FIP competency framework were written by Lebanese people as well. So many of the Lebanese researchers were part of those competency framework, and we're very honored. So hopefully we'll be able to unite all of us and make our own. I hope in the near future.
Sure, sure. Just one last question to Dr. Mansoor about is there a difference when the graduate go to real practice? They say that there is something different. This is not what we learn. Maybe with old policies, old curriculum, it was more often. Maybe how is the gap now? When people graduate, are they feeling like something different or a natural progression of their pharmacy education? So how is that bridging happening in your place now?
Thanks for this great question. Actually, one of the policy that we adopted in all university and all colleges is having advisory board. These advisory board are from the market. So they are our eyes for the market, what is inside the market and what we need to adapt to our program. For example, health insurance. Before that, about 20 years ago, we don't have a policy of health insurance. Nowadays, the health insurance companies are in the market. All the pharmacies are dealing with the health insurance, with the insurance insurance word like deductible, co-payment, and so on. and they advise us to having that in the curriculum. So having the advisory board help to shorten or minimize the gap. Still, there will be a gap, but however, advisory board always helping to minimize that gap. And keep in mind that the pharmacy profession is evolved very fast. So we are trying to let and the student understand that there are some gap, but you need to acquire your knowledge and improve your knowledge continuously with the continuous medication, with the CMEs, with the symposium, as what Dr. Murad mentioned. And this help the student and the graduate for this gap.
Wonderful. Those are great insights from both of you. Let's now move to the next question and another panelist who can add value to this today's great discussion, what is already going on. Right. So now over to Dr. Suhaib to speak about some examples. Of course, people learn and relate very well to examples where you want to say some of the advocacies you used in your country or region actually shaped some educational policies, and also describe some implementation process into the details, some of the initial wins and challenges you faced. So we'll be glad to listen to you, Dr. Suhaib, about some examples you want to share with us.
Do you hear me? It was
Yes.
breaking up. Okay, great. I totally believe like FIB or FIB is a strong advocate. And that's I'm very delighted to be on this panel. My take, and everyone likes examples. Some examples based on my experience. Actually, recently I served as part of national, or what do you call it, like national initiatives for One Health nationally group. And the main purpose of this One Health, which was like in collaboration with Jordan CDC, with the WHO and the Ministry of Health here in Jordan, to that the whole idea behind this, we cannot separate the health of people from health of animal from the whole environment. And we start going through different policy and regulation, legislations and bylaw and law. We found there's like too much information, too much policies. And then the next question that crossed my mind, like why we are not effectively implementing all policies that I'm just reading. And then I started looking for the answer. I got some like partially get the answer, but what I found, like before I give some examples, like, okay, we as a middle income country here in Jordan, there is I'm sure this is kind of, let me use kind of pharmacoeconomical concept, the opportunity cost. So the opportunity cost would be really high in terms of giving up some healthcare services while we are trying to really reallocate resources, or trying to give up some services for patients while adapting or embracing other technology. So since the opportunity cost is really high, and that's why the adoption and the fulfillment or the execution of such policy kind of is slow here in Jordan. But still, I would like to stress that we are very aware, we pay attention for all the global issues, but still there is lack of guidance. And this maybe I'm gonna touch on that in the next question. So while I'm working with the FDA, because like here in Jordan, the provisional pharmacy actually belong to three official bodies: the FDA, the Jordan FDA, that's responsible mainly to register medication, market access, the pricing, in addition to inspection that implied for food and medication. So we work with the FDA. We try to see what they do in terms of antibiotics. And it was very wonderful kind of job. Like the efforts kind of, I was speechless. What we did kind of anti-biogram national level. And we tried to categorize Jordan to different areas, like red antibiotic, blue antibiotic, yellow antibiotic, and orange, just like the street light. And I was asking, why do we have these different colors? Because we having policy to have, for example, the red colors, they are very resistant to antibiotic. We just need to keep them in the hospital, not in the community. If we have access to antibiotic, we can't keep them in the community because sometimes we're losing control on prescribing antibiotic as or self-medicate antibiotics. Like in other words, like over the counter, we still having such issue. And again, we are addressing this, but we still need more data. Then I ask about controlled substance. We have a very strict system, like we give a medication, like all the manufacturers give a medication to community pharmacy and hospital, but still we need to trace down every single prescription, every single pill, where it's going, what the name of the patient, what the prescription, is it legitimate, is there a signature, the audit system. So I was really amazed by the amount of information that is stored, and we also work on this information. So we're not just like backing this information, we're working on this information to make categories, classification, and prediction for what might happen. So another example, after getting feedback from stakeholders, physicians, community pharmacists, different nursing home, we found that some medication getting abused, like alprazolam, benzodiazepine, or what we call them Xanax, or Lyrica, pregabalin. So we start having them back under controlled substance based on the feedback. Another example, that like for pregnancy using a vitamin A, Roaccutane, and people like stakeholders, I mean like physician and general physician complaining of the rate of abortion. So we put it as policy and a strict policy. Then we about the antibiotics. So actually what we're trying to do, like especially with the FDA, like in collaboration with the Ministry of Health, because mainly Ministry of Health monitoring the health status, vaccination, licensing, we're trying to getting feedback, analyzing such feedback, and trying to make an action. Even though this action might be slow somehow, but still, like we are doing something, we're trying to back up data, we're trying to do a community campaign, we're trying to educate school and pharmacy through our third body, which is the Jordan Pharmacy Association, that mainly trying to run continuous education, activities, awareness, public awareness, and all this stuff that could help increase awareness among people to restore some policy, execute them in the right way, and to do advocacy in a very informative way. So this is mainly some of the examples that we work on it. In terms of antibiotic, we're still collecting data because we need to do something, but let's remember this is kind of a global issue. And I totally believe what happened in one part of the world could happen in Jordan. What happened in Jordan might affect pharmacists in the UK and vice versa. And this might be like a call for international framework. Like we have international framework. Like let's remember in COVID-19, the majority of people, healthcare providers, responded in the same way. They always use empirical therapy with no evidence. And now this is the time to go back to the guideline and to just quit such like empirical or non-evidence-based practices. So our profession is growing, very accessible for people with a great value. Especially in the recent years, like we have the residency program, we have the like patient side practice by like pharmacists become just as important as the physician who's prescribing medication, and we are pharmaceutical care practitioner. So we are trying to do our best to maintain the integrity of policy and promote such advocacy.
Wonderful, Dr. Sohaib. So I can point out almost all competencies you are touched upon in your example. So wonderful compilation of important points, starting with cost aspects, safety aspects, collaborator, all those, and trustworthy, being a trustworthy professional, being pharmacist. So I just want to go back for a comment from Nisreen about, she was also mentioning interprofessional education and practice. So was there any example you want to add, Dr. Nisreen, about how can you make sure that this educational change is empowering students? Because students are our wonderful partners in this policy change. So how to empower students in having these qualities of being great collaborators, trustworthy, all from the education period itself? Over to Dr. Nisreen.
Thank you. So there's a very important thing that with the competencies, when we shifted toward competency-based education, the main goal was in order to seek international accreditation. And this is one of the main things that we have been doing in Lebanon. Pharmacy schools have been seeking international accreditation, which has transformed pharmacy education in Lebanon all in all. And this aligned us with global standards and enhance the quality and recognition of our programs and our graduates. So usually the implementation process, it involves the faculty, the students, the administration of the university, plus the stakeholder. I know it's a lengthy and complex process that needs much effort and resources, but so much rewarding for us and our students, because accreditation led to a dynamic competency-based curriculum, as I mentioned, and enhanced the credibility of our program and opened up global career opportunities for our graduates. So they're very happy with this, actually.
Wonderful. Dr. Mansoor, do you want to add something before we go to the last question?
Well, I couldn't agree more with Dr. Murad when she said that accreditation. Of course, it's a lengthy. However, it's worth to do that because it makes sure that we are teaching the student what we're supposed to teach. We are monitor all the uh, program are learning outcome or what we call it K learning outcome and also the course learning outcome. We have one initiative in Saudi Arabia that we are trying to having a unified program learning outcome for all the colleges and university. And of course that each university they or each college for each college they can have their flavor that they can go to focus more in community rather than in industry, for example. However, if we have a unified program learning outcome, this will make sure that all our graduates in a different college, different school, having the minimum level of the practice.
Thank you, Dr. Mansoor.
I would like to add in that, just like less than 1 minute, just to support my colleague's statement. One of the examples that we really like now practicing in Jordan based on the ACB reflection, because we have ACB, the majority of Jordanian school of pharmacy obtain the ACB, we start doing early exposure. So students at their early years of the pharmacy program, whether in the B Farm or in Farm D, they're going to get exposed to the community pharmacy, clinical pharmacy, hospital pharmacy, manufacturer, and different pharmaceutical company to grasp or crystallize the idea of patient care is going to be in the center. So by the time they graduate, they have different paths where they're going to set their heart, whether the clinical, whether like in bio-related kind of business, whether they want to go more of manufacturer. So I think ACB like implemented or promoted several standards and quality that we, specifically in Jordan, felt like the market for our pharmacists has been expanded. Now our graduate can go and work in the neighboring countries easy, with no competition, with no any barriers, whether cultural or scientific or competency. So this is one of the advantages that might open up once we consider a national organization support or national framework.
Wonderful. Rightly said, Dr. Sohaib. Actually, we have in GMU in UAE, we have strong advanced pharmacy practice experience in the final years. But currently, we are working on structuring some early clinical exposure because many students keep asking for that. And that initial impression will make them love the profession and give them full heart in studying and becoming a pharmacy professional from the very beginning of the program. So very important point you raised. Yeah. Now, let's move to the last question, which is a very important question. It's all about how to become great partners. We cannot have this change management or advocacy and policy development or change without having great partnership. And FIP has been a great academic partner for people in the region. So how do you feel like can, from your wisdom, how FIP academic session be a partner in assisting you with influencing educational policy in your region as well as in your country? Over to Dr. Sohaib.
Yeah, thank you. Yeah, this is a very important question, as a matter of fact. And I would like to answer this question by giving a glimpse of pharmacy in Jordan. We started like the first pharmacy school or pharmacy, just private pharmacy in Jordan 70 years ago. In 1950, we have our professional society, Jordan Pharmacists Association. So this is like maybe 6 years ago. In 1960, we adapted the clinical pharmacy. We need to be patient-oriented. In the 1990s, we start adapting and embracing the pharmaceutical care. So the difference between pharmaceutical care as a practitioner and clinical pharmacist is that in the pharmaceutical care, and this is like the global concept and the most recent one, we need to target outcomes. The overall outcomes is quality of life, but we need to target different outcomes, improving blood pressure, improving mortality and morbidity, something we can measure. So this is one thing. Now, in order to achieve our mission, again, our pharmacy school depends on or rely or working hand in hand with Ministry of Health, FDA, and our professional society. So it's easy for us to collaborate, to advocate in terms of any issue that came up. We believe there's some change need to be happening in terms of antibiotic. We easily advocated to one of these bodies and they take the proper action. Might be this action could be slow or adapted slowly due to, I mentioned, the opportunity cost. So this is clear. Now, one thing I need to stress here is something I would love to see, and I'm pretty sure, like with the help of FIB, is meeting of minds. So we need all those brilliant people to come together around the table and suggest a framework. Like if we talk about data, data is the most important thing that we might build on and predict and model to see where we're going in terms of antibiotic resistance, smoking cessation, chronic disease, because the whole globe sharing a common ground. The common ground could be summarized as there is a rise in chronic diseases. No one can deny this. Second, everyone, there's a high demand for affordable and accessible healthcare. So the whole world is one small college of pharmacy. I'll call it this way. So now what FIB gonna do in what I believe can help in this aspect, data, sharing data. Like if we have a data from different countries that have an integrated system or health technology assessment, taking this data, we can work on statistics, see the trending and apply it in our system for two purposes. One, we can model and save time. Second, we can predict and save money and resources. Third, I could add the third point, we can avoid such duplicate in the effort. Like FDA can do something, Ministry of Health can do something else without doing the same thing at the same time, and this is going to be waste of resources. So I think data is something very important we need to consider. Second thing, training. Like again, like health technology assessment is there around, but many countries like having a full embrace for health technology assessment. Other countries, they still have small part of it. Why is that? Because the stakeholders are not agree like in a harmonious way. Some they suggest, some they refuse. Different reason. This might be economical reason. This could be like a market share reason. There's specific reason. But HTA, once we adapt it, we can easily promote policy by doing comparison, different medication, different medical devices, different technology. Then we give a piece of information, evidence-based for policymaker, as simple as that. Who can help in this? ISPOR. ISPOR actually one of the society, like it's called International Society for Microeconomy. And by the way, I'm the regional lead of ISPOR in the EMA region, South Africa and Europe and Middle East. ISPOR like implementing HTA. We know the HTA, we have all the concept, but still there is a lack of guidance. And I think here where the FIB can play a significant role to combine all this expertise, meeting of minds, and doing like maybe macro credentials, webinars, training, capacity building. And another thing that might really enhance the importance of this idea that we as pharmacists and healthcare providers, we share responsibility, but not as much as the authority that we have. So I'm responsible for prescribing wrong medication, but I don't have the full authority to prevent such maybe medication. So collaboration with different organizations, promoting policy in a very effective way, and measuring the implementation of policies. So this is something very important. We need a benchmark. We need the feedback. If we are implementing a policy, we need to see the feedback of such policy, whether it's working or not. We don't need to waste more resources. We don't need to waste more money. Dr. Barry Blight and I actually trying to write a proposal to create micro credentials kind of thing for pharmacovigilance for vaccination. Why we came up with this idea? Because we believe students need to have a smooth transition from the bachelor to the master or the higher degree. Also, we believe maybe sometimes we don't need to study 10 years to get a degree to go to work in a particular things like pharmacovigilance. Maybe it's only 2 years. I save time, I follow the market, I meet the needs of the patient because it's all about patient. So different scenarios can be charted out and help us to get the data, analyze the data, collaborate with other big organizations that care about cost effectiveness and cost utility. And I believe this is how FIB can really play a significant role.
Great, great, wonderful. We'll have some inputs from Dr. Nisreen also. Any FIP, she was mentioning before about some FIP standards, guidelines, some resources. Up to what level it can be like a part of curriculum planning. How FIP can help in designing the courses, continuing education, or the core program. What's your input about that? Because we have many participants from many different colleges. They can have like FIP membership for the institution, as well as to have people work in different working groups of FIP. So what's your input about how audience can be benefiting from FIP's expertise? Dr.
Actually, as I mentioned earlier, what FIP has been doing is establishing standards and competency that align with the global best practices. And that was very important for us to integrate into our competency-based framework in my organization and multiple as well. However, an additional thing that FIP academic session can help us with is aid in the accreditation process. By that, ensuring that the pharmacy programs meet international quality benchmark, fostering consistency and excellence in pharmacy education across all of the region. And actually, what FIP has been doing and providing a global platform, we have collaboration among international partnership, among educators and policymakers. FIP has been sharing best practices and innovative solutions that all of us have been using. As Dr. Sahib mentioned, we have the capacity building. We already know that FIP is doing a lot of training and resources, but however, the more the better. So because these efforts can help us as develop our skills and knowledge, supporting professional growth, and as such strengthen the overall educational framework, ensuring high quality education and preparing our students for the evolving demands of the pharmacy profession. Also, of extreme importance would be research initiatives. By encouraging studies that address regional challenges and sharing global insight, FIP can inform local policy decisions and improve educator outcome, guaranteeing that pharmacy education is evidence-based and continuously evolving to meet our regional needs. And finally, I would say advocacy and policy support, and that's crucial. What I mean is that by developing policy briefs and recommendations tailored to our regional needs would be very much helpful for us.
Great. Many thanks, Dr. Nisreen. With few points from Dr. Mansoor, then we can go back to Dr. Janine for the next section of this event. So over to Dr. Mansoor for any additional inputs or reinforcing.
Well, yes, I believe that education is not only in the schools. Education is also for a practitioner, and that's why we have continuous education hours. So maybe if the FIB can collaborate with the licensing body in the region, in each country, that responsible for the continuous education for pharmacists, and they can offer online session by FIB, and it will be counted as continuous education, saying that having that will help the pharmacist to be updated not only in the region but also globally. What is a global effort that can be implemented in the region? This is one thing. Second thing, I love the way of the FIB that they define the scope of practice. So we have social administrative, what is the scope of practice? We have pharmaceutical science, we have a clinical science. So having this one, having this competency and give it as a national framework yeah, as a guidance to develop a national framework. This will be very helpful for the developed and developing countries and region.
Thank you very much. Now over to Janine for the questions from audience.
Excellent. It looks like we have one question in the Q&A that is specifically addressed to Dr. Mansour. And it says, I think the irrational use of antibiotics is massive by physicians, while in the absence of drug algorithms. In specific, this participant says, in Yemen, we direct our licensed associates to prescribe antibiotics in minor cases. Can you provide some guidance for our participants, specifically to antimicrobial stewardship, antibiotic use, and drug algorithms, for how you think advocacy and policy would help?
First of all, having the antibiotic stewardship is usually it's come from who's specialized in an infectious disease with the physician and the pharmacist, with the cooperative physician and pharmacist. In my opinion, that enforcing the policy, usually it's very hard at the beginning. However, later on, it will be good for the safe practice. So going back to the question of Mr. Muhammad, when he said that if it's okay to having the licensed associate to prescribe antibiotic in minor case, it's depend in the if you have actually a stewardship program. If you don't have a stewardship program, I don't think that this is a right way to do. Given the fact that maybe in a few years we'll develop many antibiotic resistance, and it will be very expensive to deal with that.
Excellent. That kind of helps us.
Yeah.
Thank you. Excellent. That helps us think about, again, initial approaches, but also then continuing on with how we evolve in our approaches as we get our insights and experience. So I am going to first ask Barry, as we have been going through, we've been looking at the chats and the questions, but we've also been thinking about what you want to know about educational policy and advocacy for the region and some of the things that were shared. And so, Barry, do you want to start by kind of sharing some takeaways that we have in the system, or that some takeaways from our session today that we could share with our audience?
I would love to. And again, as I said in the chat, I'd like to thank our esteemed panelists and our moderator for going through. This is one of the shortest time frames. I said, boy, we've only been on 10 minutes and we've been on an hour, and I went, wow. But one of the key things that it was said earlier, and I think it's very true with everything that was said, is what happens globally can happen locally. Okay. And that's what each of the examples provided by our panelists and our moderator talked about. Things that are happening in different parts of the world are happening in some way or other within there. So, you know, the responses, the advocacy that they got into, the partnerships, the collaboration, and those things, I think were very big lessons. And I think one of the key points is you work with people, you work with your practitioners, you work with your professional organizations, you work with the accrediting bodies, you do these other things, and that really helps. And then the other thing is we haven't mentioned it, and you and I will get more into it as we go on, is that there are a lot of FIP resources, okay, that are available to people in these categories. And some of them are best practices. Some of them are networks of people that are together, such as this webinar and those kind of things. So those are two of the key points I wanted to bring forward, Janine. What do you have?
Yeah, I think we had so many amazing points to take away. I kind of summarized a little bit by category. So the first thing that I had thought was, again, our speakers talked about understanding where the challenges in education and practice originate from, getting back to that source and really focusing on those pain points or those needs of the community, and adopting policies, again, as you discussed, for medications, for resource limitations with cultural adaptations. And Dr. Nazreen really emphasized, again, needing to be aware of the culture and the cultural intersections. Then we talked about ways that we could work with regulatory education or regulatory organizations and other educational organizations to really tackle these challenges as a united front. For best practices, we talked about adoption of global practices and global harmonization. And Dr. Suhaib mentioned that for us as we went through our discussion. We also talked about considering patient care needs with interprofessional partners, and thinking about the ways that that can impact our efforts, strength in numbers. We discussed incorporation of a lot of these things that we wish to see in practice into our clinical training, both early and late practice. And we gave an examples like working with groups for guidance documents, and thinking about standards or different approaches with regulatory organizations. So there were so many great things that came out of this session. I agree with Barry that this is amazing. I would love the panelists to get on for a picture that we can share. And we would also love to engage you and to have you involved. So if we are thinking about this, we would like to know, and there's a survey open where you can share what has worked well for you. And some of you had mentioned in our chat today some additional resources that would be helpful. But you can share how you would like to connect, which of these examples for FIP involvement would be helpful, and what you would like to see prioritized. And we always want to hear from everybody who is involved. Again, as we are thinking about this, we need to stress how important our speakers and their wisdom are, but also all of you, how much you are important to the organization.
Yes.
Okay,
By the way,
you're going to smile.
Yeah. Okay. While we're smiling, I was going to say I put in a link to a survey that the academic pharmacy section is running right now, in terms of looking at what are the needs of people who are young faculty members, mid-level faculty members, and those who want to enter academia that they may have. So I put those links in there if they would like to participate in that survey. It's open for another 2 weeks.
Excellent. And all of these speakers that you see highlighted here today will also be highlighted in a speaker spotlight, which we will be posting after on social media. So you'll get to, again, kind of read some of the things that they've captured that they want to share with you professionally. And that will also go into the creation of a toolkit. So in the toolkit, we will highlight examples of how each of these prestigious speakers have been leaders in advocacy and policy. And hopefully that helps you to feel inspired with different things that you could be involved in as well. So again, we want to express our sincere thanks for our participants and joining us today, but then also to our esteemed panelists and sharing their wisdom and making time for this important work. So thanks to everybody. Good morning, good day, good evening, wherever you are in the world. And we look forward to seeing you at a upcoming webinar or in Cape Town, South Africa. Thank you, everybody.
Thank you.
Thank you all.
Thank you all for this
Hey,
event.
we had a very good attendance today. I was very impressed. We have
Excellent,
more here than we did at
everybody.
our town hall. So guys, you all are celebrities.
I think they came because of you.
No.
Not because
Aww.
No, we worked Janine and I came up with some of the same names, boom, boom, boom. And then it was hard because Nazreen, you first couldn't come, and then you did, and I'm glad. And then Mansour was able to come, and I was very happy because we really wanted, because he's one of the leaders in his country. And, you know, the Middle East is important, but we also needed to have Saudi Arabia as part of the Middle East. All right. So, and,
nice to see you again,
And
Barry.
Dixon, you know, it's funny that Janine and I both have worked with you on different things. And one of the first names that came out was yours. And I went, wow, you know him too? So, well, I hope, I know Suhaib is planning on going to Cape Town. I hope we can see some of you guys there because we need to give Ali a big thanks for taking us through this. Thank you, Ali. Thank you very much.
Thank you so much. This was great. I enjoyed every single bit of it. Have a great rest of the day.
All right.